that actually brings me to my next question, and I will combine a few questions at once. Because of your book and because of all the principles that I have applied, I actually cannot advertise anymore. I may not accept any more new patients, and we're talking about multiple locations. So my next goal would be to drop some insurances, and that would also help me not to need to hire so many hygienists. But when you say make a dentistry more affordable, please, can you talk more about it, making dentistry more affordable? When I hear making dentistry more affordable, to me, it's to take all the PPO plans that I can do to offer discounts. And to me, when I hear make dentistry more affordable, to me, that means that taking more insurance plans. Could you explain what do you mean by making dentistry more affordable, and how should we proceed with PPO plans, or even maybe not to access many plans?
Yeah, so it's two different questions, really. Making dentistry more affordable means using technology. Let's say if you can use cone beam technology, and it allows you to fully restore a single tooth implant in one visit, you don't have to get $4,500 a tooth. You can get $2,500 a tooth and still make $2,000 in the 2.5 hours that it takes you. So that's what I mean about using dentistry to make it more affordable. If you use CAD/CAM technology, if you have something like CEREC, now you're not doing a temporary on the tooth, and you're not coming in, bringing them in 2 weeks later or 3 months later, whenever they show up, and taking that temporary off, probably using shots and drills. Nobody gets paid to take temporaries off and finish the tooth. It's one price for the crown. So when you do it in one visit, you've done it in significantly less time with less material. So you don't have to get $1,400 a crown to still make $400 a crown. That's what I'm saying is you can maintain your profit level while dropping the actual cost of the patient. Now, does that mean you work with insurance companies? Only if they are paying you enough. But dentists are so afraid of dropping a plan, they say, I'm going to lose all of these patients. The data just doesn't support that. If you do it properly, if you notify them and say, the reason we're not accepting this plan is because it doesn't allow us to treat you at the level at the standard we use for care in this practice. And it is only a discount plan for certain care with a limit on it every year. It is not health insurance. It is nothing like health insurance. It is a discount plan on some basic care. That's all it is. And they are reducing the amount they pay us to the point where we can no longer treat you the way we need to treat you. And what happens is you lose some patients, but you open up your schedule to full fee-for-service patients. Because you'll find, if you analyze what you're making, and that's what you have to do, you analyze each plan and say, are we breaking even on this, or are we at a 5 or 10% margin, profit margin? Why do that? Open up your schedule, and if you dip temporarily and start to fill it with people that are paying full fee for service. And you have to look at the demographics of your area. You have to look at your own patient base. So if you're 90% insurance based, don't trim all the plans off in an afternoon. Look at the worst one and trim it off, and allow it yourself to recompensate. But don't and incorporate membership plans. Membership plans are subscription plans that work perfectly well, keep the patient captive, and actually bring them in more often. So you can have a comprehensive approach to dropping your plans. There was a time when people were dropping all their plans back in 2000, and then they realized that things were getting tough in 2008, 2009, they started to put plans back on. And then the dental insurance companies realized that they had them. And now they're taking advantage of them. They're not, in my mind, out to benefit the dentist. The irony is that dental insurance companies were formed by dentists as nonprofit organizations so that more patients could get care. And now it's just turned into a very profitable nonprofit organization where the executives keep the money, essentially. And the dentists get less and less money all the time, to the point where it's impractical. So work less, make more money, treating people at the level of care you want. Otherwise, people are actually getting if they're using their insurance to dictate the care, you can't even give them the care that you, in good conscience and then as a professional, know you should be giving them.